Hi, I'm Dr. Diane Levin Zamar. I'm the Director of the Department of Health Education and Promotion for Clalit Health Services, Israel's largest health service organization, Assistant Professor of Public Health at Haifa University, and also the co-chair of the Global Working Group on Health Literacy of the International Union of Health Education and Promotion. My work in health literacy really focuses on how we see health literacy as a vehicle for empowerment, for people to be able to take more control over their health. Health literacy is really an emerging social determinant of health. It's probably going to be we're seeing more research on health literacy as the missing link between other social determinants and health, for example, education and social economic determinants. And we're understanding more and more how health literacy is really going to be understood more as a moderator and as a mediator for health behavior and health outcomes. So in the work we do in health promotion and health program intervention, we're looking more and more at how health literacy can be developed, how it can be influenced, and also how our organizations can be much more appropriate for health literacy and be able to bring people closer to their health by our being more appropriate for health literacy. And this is a new concept because instead of just saying, well, how we have to improve people's health literacy, we have to improve what we're doing in order to help people who have different levels of health literacy promote their health. We're going to be seeing some future issues that we'll need to deal with more. The issue of looking at how youth can be more involved in health and health literacy, how we can also help people understand more about the critical health literacy aspects, particularly in media, and being able to, when they see and they're exposed to messages in the media, whether they're implicit or explicit, how they can become more aware of how these messages affect their health and what they can be doing about it. We're also really interested in looking at the cultural humility in health literacy, and that it will be also more and more seeing cultural humility, health literacy as influencing factors for social justice, to be able to also empower people about what they're saying, what they're doing, and what they're promoting for their own health based on aspects of their culture, aspects of their social background. And we're hoping that the organizations and the systems become more sensitive to issues of cultural humility, cultural responsiveness, cultural appropriateness, cross-cultural issues. And there's more and more tools for that, and we should be training more people to understand why that's important in the job that they do. Another important aspect, which we haven't done enough on in health literacy, is ethics. What are the different ethical aspects of health literacy? Are we, as a profession or as a group of people who are concerned about health literacy, are we thinking about our ethical practice enough? It's an open question, and we have lots of discussion about how we should be answering that question. But like in any other field, we have to make sure we're always doing the right thing, not just being well-intentioned, but also make sure that we have the ethical practice just going side by side into all of our interventions. And finally, I would like to say that health literacy is an asset. I think we have to change our language. Maybe we can replace low health literacy with another term that isn't judgmental, and to be able to see that health literacy, no matter at what level, can always be a support for people doing a better job for their health. And the more we can be sensitive to that, the more we can be less judgmental about where people are as far as their skills in health literacy, we'll be doing a much better job. So we need to get the public on board for health literacy, not only the professionals, and not only policymakers, and not only researchers. So hopefully that will be the future of our work in health literacy.